that story alone is basically where hospitals and clinics are colluding with insurance companies to rip off consumers. Period.
Well, they're often owned by the same entities. You look at you pull up an SEC filing of United Healthcare. Look at all the subsidiaries. They have their hands in both pockets. And so that's where they're meeting the medical loss ratio by spending other people's money and then collecting with the other hand. I mean, we're talking PBMs, pharmacy benefit managers, medical device manufacturers, everything along the supply chain, they have their hand in the cookie jar. And so then everyone throws their hands up in the air and says, healthcare costs are just going up again. Sorry, premiums are going up 8%, 9% again. Just nothing we can do about it. So sad. And their business model is now predicated on those prices continuing to go up, because not only do they make more on the medical loss ratio, they get to sell more fictitious discounts. They get to collect on the spread when they sell it to the self-funded employers, and they get all of the backstream revenue from the medical, where all these bills are getting paid. All the suppliers at the pharmaceutical level, at the medical device level, that's funneling back into the carriers' pockets. And because of the way the medical loss ratio applies to consolidated financial statements, the money they make from those backstream revenues does not apply to the medical loss ratio, does not apply to those dollars. And so you have, it is collusion. It's one of those situations where you feel like you're using a word provocatively and maybe overstated until you look it up on Webster's and you realize that what I say is I think Keith is the first one who called it this, but it's a cartel.
Yeah,
the dictionary definition of a cartel. You have entities colluding to maintain high prices. And this is the part that cracks me up. You even have the hitman with the baseball bat going to make sure you buy the product. It's called the IRS.
That's right.
You will buy the product. We have this horrible product. And if you don't buy it, we're going to tax you.
Right.
It's a cartel.
It is. Well, and cartels also do some pretty nasty things to stop other people from getting into their business. And when you look at this, we could go on and on, but when you look at what certain hospitals have done in certain states with certificate of need laws, they've made it almost impossible for doctors to open their own surgery center. Or for instance, because of Obamacare, it's illegal for a doctor to own a hosptal.
Yeah.
I don't know if you knew that, David.
Oh, yeah.
It's illegal for a doctor to own a hospital. I mean, think about that.
And think of the reasoning. The funniest part is, that would be such a conflict of interest. We can't have physicians benefiting from the care they're giving. Let's let the insurance companies own the hospitals. That would be such a
I know. It's crazy. Well, yeah. And it's like, I mean, pharmacists own pharmacies, right? Mm-hmm. And attorneys own law firms. I mean, it's crazy. It is crazy. And it's just, fortunately, there's a parallel system, the free market system, which you are part of. And thank you so much